Nice to meet you.
I'm Ellen DeGeneres, and this is the Ellen Show. With us today, we have Pippa, the leading scientist on C-sections in China. What have your studies found, Pippa?
Well, in 2010, the World Health Organization reported that the C-section rate in China was 46.2%, which is fairly high considering that doctors say ideally 19% of births would be by C-section. There's this new study that examined data that was gathered from public records of the total number of births and the number of births by C-section in China over the period of 2008 to 2014. So according to this study, the rate at its highest was 34.9% in 2014. So this is significantly lower than what the World Health Organization was reporting. And this rate is also comparable to the US C-section rate, which is about 32%. And the study also acknowledges that there are significant geographic disparities in these rates. For example, in Shanghai, the rate of C-section is as high as 68%, while in rural parts of China near Tibet, C-section rate can be as low as 4%.
Wow, that sounds amazing. But, you know, we live in a time of alternative facts and fake news. How do I know that this study is legitimate? Who published this study?
Well, this study was published in the Journal of the American Medical Association, and that's a pretty reputable source.
All right. Sounds pretty reputable to me. Well, even though the publisher sounded pretty legitimate, how do we know that the people who funded this study have good intentions?
Well, the people who funded this study are the National Health and Family Planning Commission of China and the National Natural Science Foundation of China, as well as the Beijing Young Talent Program. And so I think that there's no one source of funding for this, so it limits the influence that the people who are paying for this study have on the results of the study.
That's great. So in this study, who's the population of interest? Who and what are we trying to learn about?
Well, it's about Chinese women who gave birth during the period of 2008 to 2014. And we're trying to understand the availability of C-sections and their use, as well as the geographic distribution of them.
So within your population of interest, how do you choose a sample?
So the sample was taken from anonymous data about women that are having babies, and these Chinese doctors take down all of this information in their own districts for population control purposes.
That's great. So do you think that your sample accurately reflects the population of interest?
Well, not entirely, because if the birth is non-residential, meaning that the parents are not from that specific district in which they have the child, the data for for the mode of delivery, so either C-section or vaginal birth, is not actually recorded. So the data suggests that about 90% of births are documented.
So what steps did you take as a research team to avoid a sampling bias?
Well, the main source of sampling bias in this study was that we used records that leave out part of the population, and we chose this method for convenience, but if the study had been done in the US, we wouldn't have had access to these records. So we would have had to try a survey, which could lead to non-response bias. So there's no perfect way to do this. And we used census data instead of making our own sample, which again was out of convenience, but it was intended to reduce sampling bias.
Cool. So what was your research question, and do you think you answered your research question?
Sure. So we wanted to know if the WHO statistics of C-section rate of 46% in 2010 was actually accurate. And so we wanted to know what the geographical distribution of C-section rates are. And so we did find a more reasonable sounding rate, but it excluded a significant portion of the population, so it's not clear if those results are conclusive. But we found an association between urban areas and having more C-sections, and this information could be used to help target certain populations that need more information about the pros and cons of C-sections. And the findings were that cesarean rates increased from 28.8% in 2008 to 34.9% in 2014. However, there was substantial variation across China's 31 provinces, with rates ranging from 4% to 62.5% in 2014.
So, would you consider your study an observational study, or a survey, or an experiment?
It's an observational study because we took data that was already existing, and we didn't ask women who had children about their delivery mode.
All right. So when you were writing your paper, do you think you accurately conveyed your ideas in your paper? And also, what kind of audience was your paper for?
Sure. Well, we published this article in the Journal of the American Medical Association. So it is for doctors or people who read that publication. But there are articles, like the New York Times has recently published an article about this study, which is much more sort of at the level of the general public. And so our results are hinging on the assumption that the rates for women whose data was unavailable is similar or the same to those who we did have data for. And we can't show a causal relationship between the most recent decline in C-section rates and the policies that are targeting those rates to bring them down. And so we try to be very explicit in our study that it doesn't provide any sort of causal evidence for any trend that can be attributed to our findings.
So since this was an observational study, were there any lurking variables?
Sure. Well, there are the obvious people who weren't counted in this study. And then a question that came up was, do we know that you get the same kind of medical care if you're not from that district? And we also think that culture may have affected this study. An example of this is the different conceptions of relative safety of the different methods of birthing.
Yeah. Do you think that there could have been any other additional sources of bias? And if so, what steps did you take to reduce that bias?
Sure. Well, researcher bias is probably the most obvious one. And so we had lots and lots of researchers participate in this study. So some of these researchers, their job was to collect data, and some people their job was to author the paper. And this was done intentionally to help prevent researcher bias. And another thing that we did was we used anonymous data. So the researchers that were collecting the data, their perceptions of these women could not influence the results.
So if you were going to do this study again, what would you do differently?
I think we would have included a survey portion in an attempt to reach those women whose delivery methods were not recorded. And this may have been difficult due to anonymity, but I think using a survey could help us find the reasons why Chinese mothers most often find C-sections desirable. And there are a number of projected reasons that have included sort of thinking that it's safer, or the availability and relative safety depending on where you are, and the perceived benefits and cons to a C-section.
Great. So if you were to rewrite this article and just rewrite the paper aspect, what would you do differently in that respect?
I think that visuals are really helpful, especially for sort of the general public, not so much maybe for researchers who are also reading this paper. Possibly using visuals to show where geographically these rates differ would be really helpful, I think.
Thanks for coming on the Ellen Show. I've loved having you here. Let's give a big hand for Pippa the scientist.